Okay, students, today we're going to talk about the second transition area of the upper limb. The first one we have talked about already in the previous videos. If you haven't watched it, then you should watch that one first. So we got here the cubital fossa. Cubital fossa is an important area of transition between the arm and the forearm. It is located anterior to the elbow joint and is a triangular depression formed between the two forearm muscles. What we call them brachioradius and the pronator teres. So let's begin here. We go to the outlines. We will talk about its definitions. We talk about the boundaries. We talk about the floor and also the superficially what we got here and the content and the clinical correlation of it. So when we're talking about the definition, it's a depression, triangular depression in front of the elbow, and is a second transition area, letting the content to pass through there. So talking about its boundaries, we got here the brachioradialis muscle that is making the lateral boundary. We got here the pronator teres muscle that is making the middle boundary, and here we go to the transversal line between the two epicondyle of the humerus that is making its base. So this yellow color is representing the triangle, what we call that cubital fossa. We go the supinator and the brachioradialis muscle in the floor of the cubital fossa. If you're talking about here, we got in this diagram the content. Now we can talk about the content of the cubital fossa. If we talk about the content of the cubital fossa, the median nerve, we got here the brachial artery, which is going to terminate and divide it into the radial and the ulnar artery. The tendon of the bicep muscle, we got here the radial nerve and its tree branch. Superficially, if we talk about, we got the very important vein, we call that median cubital vein, which is actually formed by the cephalic and the basilic combination here at the elbow when they join together, and it is very important for withdrawing the intravenous blood or infusion. We got here the cutaneous nerves, and what we give them the name as the medial and the lateral cutaneous nerve, and we got here the aponeurosis of the bicep. So we got this content in the cubital fossa. When we talk about the clinical, as we can see here, the median cubital vein is actually the golden point that to perform the intravenous. We also perform the fistula. Fistula is actually what when need to perform the hemodialysis, when the kidneys are not working anymore and need to perform the dialysis. So one kind of dialysis we call that hemodialysis, in which the blood we need to withdraw from the body and then clean it and again return back into the body. So to get the blood, we need to perform the fistula between the artery and the vein. So here we can see one example of the fistula. Next, we are having here another example representing how we perform the dialysis fistula. We cannot just give the blood from the vein for the dialysis because it is very slow in pressure, and we also can take from the artery that is very high pressure. So to get the moderate pressure that we are getting from the artery and the vein at the same time, so we construct the fistula between the artery and the vein. If talk about the further clinical correlation of the cubital fossa, that during the blood pressure measurements, the stethoscope is placed over the brachial artery in the cubital fossa. The brachial pulse may be palpated in the cubital fossa, also just medial to the tendon of the bicep. Thank you very much.